My name is Karen Boite, and I am from the Ontario Autism Coalition. I'm a member of our board, and from time to time, we do some Facebook Lives with some really smart people. The Ontario Autism Coalition is a group of parents, self-advocates, therapists, teachers, people, grandparents, all kinds of folks. And the Facebook Lives are designed to bring our community together, to help folks share their thoughts and ideas and ask questions, and to bring super smart people to you, especially those of you who live in communities who you're waiting a long time for service and you may not have access to therapists for a very long time. So, hi.
Hello.
Hi.
So this is Louie.
Hello.
This is Nancy. Louie, who the heck are you?
I'm Louie. I'm a behavior analyst, past president of ONTAPA, and OAC member, proud OAC member, and I'm thrilled to be on the Facebook Live with Karen. I was saying I was a bit starstruck because I've been watching.
Oh
these
my
for so long,
God!
So thank you.
Yeah.
Thank you for having us.
Yeah. Louie is also the Elvis of the OAC. So, you know, hunka hunka. All right. Who the heck are you, Nancy?
I'm going to switch this a little bit. Is that okay? Okay, there. Are we on? Okay, perfect.
Yeah.
So I am a professional who's been working in the field of behavior analysis for over 20 years now. I am a board certified behavior analyst, and I'm also a psychologist. And I think the most important thing is just I love working with kids and their families and helping support them and transform kids' lives. I mean, super passionate about that, and I'm so happy to be here today to talk about what we do to help kids live their best lives. That's my job.
All right.
And also to put myself out of a job. I always say that. My job is to put myself out of a job.
To put yourself out of a job?
Yes, it is.
Yeah.
Because I love the day that kids don't need the extra support anymore.
Yeah. I look
High
for the
five to
day that I
everybody.
can fire my team
Yes,
too. I'm
that's
looking
great.
forward to that day.
Fantastic
You know,
day.
as
Yeah.
much as I love that.
Yes, that's right.
You're fired.
Yeah.
Not yet.
Yeah.
Oh, okay. So let's just push on. There's a huge demonstration happening in Toronto right now, so I suspect not a lot of people will be joining live. You are very welcome, if you happen to be watching us, to send questions, and we'll try to catch them in the feed. I have a number of pre-submitted questions from our members, and they're great ones, and we'll just push on. Okay, so here we go. First question from Karen.
Okay.
Some lady,
All right.
some housewife in Scarborough. Nancy, we are here at your center, Breakthrough Autism Today. You are a BCBA and a psychologist. My kid has been in a center like this one for a little while now. So I kind of know that if I was to ask you what is ABA, that's a pretty broad question because the scope of your work is so huge, right? So I want to break things down and get people who are new to this life to get a sense of what you do.
Sure.
You know? Okay.
Can
So
I say
yeah,
one
go
thing?
right
Sorry.
ahead, please.
Because I do want to say a little bit about what ABA
Okay.
is really broadly.
Even better.
And then break it down.
Okay, good.
Because I think it's important for people to understand that ABA is a science. It's the science of learning. It actually doesn't just apply to kids with autism, even though that's often where we associate it, because historically of the funding, really, I think, is a large part of that. And because of the tremendous work that professionals have done, kids have done, families have done that demonstrate the power of ABA with kids with autism. But it is a broader science, and it involves learning. And so it applies to really how we learn anything. I actually brought some examples.
Okay.
Okay. Just
I
to,
like how this is
beyond beyond autism. Autism is super important. That's my passion.
Yeah.
But I'm actually studying. I'm doing my PhD now in my part time. My spare time. And I'm not doing a PhD in autism. I'm doing a PhD in behavior analysis, and it's broad applications. So here's an example. I don't know if you can see this book. It's called The Too Busy Trap. This is a book about how behavior analysis applies to the workplace. And actually, this is about how we can manage our time better. And there's a series of this. So one place that we actually use behavior analysis beyond autism, just one example, is to help people perform their best in the work environment, create nurturing work environments, compassionate work environments that help people do the best they can do. So People might not realize that. Here's another example. This is a book called Meaningful Differences. It's one of my favorite books of all time. It's about a study that was conducted by two fabulous behavior analysts called Betty Hart and Todd Risley. And what they did was really phenomenal. They studied kids' language development in inner city schools and also in affluent homes too. And one thing that's so phenomenal, the big take-home message that they found is that the way kids develop language, and this is like any kid, right? Not special needs kids. The way kids develop language and subsequently how they perform in school has nothing to do with their socioeconomic status. It has to do with the enrichment of their environments, how people talk to them, how we engage them. It was the time that this was done was earth-shattering. So, I mean, the theme here is just that behavior analysts do work beyond the field of autism. They work in all kinds of fields. And what we've done historically over time is go into areas where people maybe thought, oh, you know, those kids in those inner city schools, like their language might not be as strong, or in the workplace, you know, we might not treat people so great, and have shown that when you use these principles, the science, you can dramatically change people's lives for the better. You can change society for the better. So that's my long-winded answer for what behavior analysis is. I don't know if you want to
Good
add
answer.
anything
Is
to
that a good
that.
answer?
I'm very passionate, as you can
Yeah.
tell.
How are you
Yeah.
doing? How are you doing, Louis?
I'm doing
Are you
well.
okay?
Yeah, absolutely.
All right.
I
Was
would,
that it? Was that some good ABA?
I think that was.
That was
pretty
great.
good?
See, there you
How are
go.
you doing?
See?
All right.
And actually, I would add
Yes.
that like some of the original applications of ABA were really, you know, in the really tough places to serve. Actually, one of the very first places was in institutions for individuals with schizophrenia and in corrections. So a lot of people don't realize that, but the first people that kind of benefited from the application of behavior analysis were individuals kind of on back wards, and at the time, and actually,
What's a backward ward?
so an institution or a forensic or a non-forensic inpatient unit where it's kind of a warehouse, and this is, you know, these were everywhere up until fairly recently, where basically the point was just put people with mental illness or other complexities away from society, and they just lived their lives there, and the conditions were usually pretty terrible. We have a number of really big institutions in Ontario that some were shut down recently, like Huronia and others, but for hundreds of years, people were living in those spaces and really labeled as unteachable, right?
That's
so
how Geraldo Rivera got famous,
That's
right?
right.
Yes,
Willow
yeah.
Rock.
Willow
In the United
Yes,
States,
that's
which is not a
right.
Canadian story,
That's right.
but
There's unfortunately similar places in Canada and in Ontario, and that's really where the heart of behavior analysis started. There's actually a psych hospital called Weyburn Psych in Saskatchewan. It's no longer there, but one of the very first applications of behavior analysis was conducted there in Saskatchewan, where they were working with these unteachable individuals with schizophrenia or intellectual disabilities, and actually showing that they can learn and they can be more independent and they can engage in activities of daily living, and you don't have to always put them on a ton of medications or restrain them. And so some of the first applications of ABA were actually like reducing restraints for people with mental health issues on these wards. And a lot of people don't realize that, because, you know, I think the majority of behavior analysts now work in developmental disabilities and autism, but our roots are kind of in mental health and in corrections, and really looking at encouraging more humane treatment of people with various challenges.
let's come back to that in a couple minutes.
Sure.
Yeah.
Let's come back to that. Thank you, Louis.
Yeah.
So tell me a little bit, Nancy, about your center. Tell me about the intake process. So what happens when you get that first phone call from a parent?
Yeah, so a couple things that are really important that I always keep in mind, and not just me, it's not just as contained to how I practice, but how really any good behavior analyst practices, is that we recognize that every individual whether it's the clients that come here, so the children with autism that come to our center, and also their families, are unique. And so that's always our starting point is, you know, I want to get to know what your story is. Why are you calling me? What is it that your child does awesome at? You know, where are their strengths? Got to know that. And then where are your areas of concern? So that's our first starting point, is to get to know that. And that is often done usually through like an interview type, informal interview kind of process, where I'm hearing your story. And then from there, telling you a little bit about, well, you know, whether or not, based on what you're telling me, can I help you? Because I can't, you know, I'm not a jack of all trades. I'm really good at what I do, and that is to help children with autism develop some of those really core skills, so that, like I said, my job is to pull myself out of a job so that they can go and flourish in school and other places. And so I make the decision, based on that conversation and depending on that child's needs, hey, it sounds like, we can help you. Or
So
if not,
let's just say, okay, you've had that conversation and the parent has said, yes, I want to come here, and you greenlit a program. What happens next?
yeah, so then the next phase is to get a much more in-depth assessment of the child's skills. And so we can use all different types of assessments for that. We have a lot at our fingertips. Now, those are not diagnostic assessments. They're not IQ tests. They're skill assessments, and there's a ton of them. So
what's the difference then between a diagnostic assessment and a skill testing assessment?
So a diagnostic assessment is going to determine, and I also do those, but not for the purposes of entering into ABA treatment. There's a different purpose for that, and that is to determine whether or not a child exhibits certain symptoms that, if they're, for example, with autism, challenges in social communication more globally, more broadly, or and also some challenges in restrictive repetitive behaviors. And so if you have certain amounts that you check off through a manual called the DSM-5, then a child may have a diagnosis of autism or other things, right? So it's a much more broad assessment to determine if there is a particular diagnosis that makes sense for a child.
Right.
At that point, they're usually like a child, typically, not always, most families who are calling me have a diagnosis of autism. I say not always because I also get calls from families who have some concerns about their child's development. Mm-hmm. And as we talked about, ABA is really about learning. So I don't need a diagnosis to treat a child. Right. If a family has some concerns about their child's development, and it falls under social communication, adaptive skills, challenging behaviors, even some academic pieces too, we can help. Right. And so how do we know what exactly we're going to do? That's the skill-based assessment. Okay. So it's more drilling down as opposed to like a diagnostic assessment. It's broad. Right. A skill-based assessment is drilling down into specific skills, and I'm going to assess based on those presenting concerns from the family. So it could be I'm looking at language, or maybe I'm looking at social skills, or maybe I'm looking at adaptive skills, so self-care, or maybe I'm looking at all of them. It really depends. Mm-hmm. And that's where the uniqueness comes in too. Yeah.
So the assessment process, what's involved and how long does it take?
So that also depends. Mm-hmm. For some kids, it can be a few hours and it's done. For other kids, it might be a week or two of, again, drilling down into specific areas. For some kids, we might have to spend a little bit more time rapport building before we can get a really accurate assessment of where their skills are. But basically, it involves looking at, so let's say, for example, a family says, okay, we're concerned about our child's language development. So then we're going to look at their language across different areas. We might look at things like, how do they request? How many words do they use? How do they label things? If I ask you a question, can you respond to it? So it can involve a number of different things. It depends on really where are the areas that we want to focus on. And then we're going to drill down and see where the child's strengths are and where their needs are.
I see your question, Sherry. I'll get to that. Okay, so you've done the assessment and you're creating a program for the child. Tell us about the team approach that most centers take. How many people are involved with the team? Let's say you've determined a child is going to be with you full time. How many people does the child work with, and how do you collaborate as colleagues at your center?
Yeah, so we use, and most centers use, if they have a BCBA, ideally, who's involved, if it's an ABA program, they're going to use something called a tiered service delivery model. Okay, that's a big name. Okay. But what does that mean?
Tiered service.
Tiered
service. So not like tier.
No.
Like a wedding cake.
That's right. Exactly.
Okay.
Yes, very
Got
good.
it.
Yes.
Someone's
All right.
yeah.
Oh yeah. Love the cake boss. Yep.
Absolutely. So we follow that because we have a large certification board. It's an international board. It's out of the US. It's called the
It's okay.
Behavior Analyst Certification Board.
Okay.
BACB. One
Okay.
of those days. Haven't had enough coffee yet.
There's lots of acronyms
yes,
in your business.
Yeah. And so what they recommend, and this is based on science, is that you need at the top of that cake, I guess, if you want to say, is your BCBA.
Okay.
Right? They're the person who is making the clinical decisions, treatment planning, looking at the overall picture of where the child's going and what are the best strategies to use. Because remember, ABA is really broad, so there's a lot of different things we can use, within our, realm. It depends on the child. They're looking at the data, so that's what they're doing. And then they may have an assistant. So that's a BCABA.
Okay.
Some places have it, some places don't.
Okay.
That's not necessary, but they may have an assistant who helps them. And then you have your frontline staff. Okay. And their job is to be the implementers.
Okay.
And so they are taking that almost like a prescription, that treatment plan, and they're implementing it. And some of them in Ontario may be RBTs, another acronym for everybody.
Yeah.
RBTs are Registered Behavior Technicians.
Okay.
Again, certified under that Behavior Analyst Certification Board.
Yeah.
Not everybody in Ontario is an RBT who's frontline staff.
Okay.
But some are.
Okay.
And that's a special designation and that requires continuous oversight by BCBA or BCABA. Okay. They're the implementers. Let's just keep it at that. They're the frontline implementers.
That's who your kid spends the most amount of time with.
That's right. Absolutely.
Okay. And how often does the kid see you? How often do you supervise and spend time with the child?
Yeah. So we again follow that tiered service delivery model. Here we actually have 5 other supervisors as well who report to me. So I take more of a senior behavior analyst psychologist function, and then they have their own BCBA as well who reports to me, or BCABA. So that person needs to see the child at least 20% of the time. So that's the benchmark that is set out by the BACB that we try to adhere to here. But again, that might fluctuate, but that's a good question that people should ask. And I do recommend for anybody who's watching, check out those healthcare guidelines because there's some really valuable information that I think all families should know that really outline, like, this is the best evidence-based approach when it comes to delivery of ABA for kids with autism. And that's the gold standard. We should all try to adhere to that when it comes to
gold
ABAs.
standard. I've heard that before.
Yeah.
I've heard that term used before.
Yeah.
Hey, Louie,
Yes.
I want you to know
Yes.
that you're sitting very nicely,
Thank
very
you.
patient.
Thank you.
Huh?
Yes.
Huh?
Did a great job.
How's that?
I've been
Yeah.
working on
Hey,
it.
Yeah.
I'm looking. Okay. So there's lots of other professions
Yes.
that
so
people
that's right,
that
yes.
work with kids with autism and other special needs and disabilities. Do you mind giving me your point of view between what is the difference between a BCBA, an SLP, a speech and language pathologist, and an OT, an occupational therapist? What's the difference between you guys?
Yeah. So, and I should say, when I was talking about the team, I was focused on the ABA team, but here too, we do work with a lot of other professionals and we welcome that. So that's a really important part of our jobs too, is to interface with SLPs, OTs, psychologists, schools, teachers, whomever, for the child when it makes sense for that child. So we welcome that. And another part of our team that is super important is the parents. So I always say the parents are part of our team too. But when it comes to the difference between the different professions, I think, for behavior analysts, our specialization is behavior analysis. It's that science of learning and how it applies to whomever we are working with. And there's a broad, I don't want to bore everybody out there, but there's a ton of research.
Nobody's bored.
Okay. There's a lot of research that backs up what we do. And our job is to know about that research. It evolves over time and figure out what are the best strategies that work with each child. And by the way, some of how we figure that out is the child tells us, right? We learn from the children, right? Through data or for them being able to tell us, right? How do you want to learn? That's one of the things we do. How do you want to learn? Do you want to learn playing this game or do you want to learn it at the table? Those are the kind of things that we do as behavior analysts. So when we look at other disciplines, and I want to say first and foremost, I I'm no expert in the discipline of SLP and OT.
Mhm.
I love them and I work with them, but that, they could probably give you a way better answer
Sure,
than I'm about to give
I
you
know.
when it comes to these.
I made Lolly Herman answer this
great.
question too.
Oh,
Poor
okay.
Lolly.
Okay. Thanks,
And
Lolly.
yeah, but I think it's important for people to know that many BCBAs work very closely with
Mhm.
SLPs and OTs, which is why I'm asking you this question.
Yeah, and so certainly when it comes to us, like some of my experiences with working with SLPs is they can help give us insight in terms of the language programs that we're working on. So we bring something to the table. Behavior analysts work very much on language, and we have a lot of science to support that. But we also have our SLPs who certainly offer suggestions, around articulation, around augmentative and alternative communication devices. So we work very closely with SLPs when it comes to, again, ones who are specialized in this area, though.
Yeah.
When it comes to PECs or use of the iPad.
What's a PEC?
So the picture exchange communication system.
Mm-hmm.
So that's where some people may have seen some kids use pictures in order to communicate if they're not able to vocalize. So we're very fortunate that we have some SLPs in this neighborhood who have specializations. Not all SLPs do, but there are some that are phenomenal at even prescribing what would be the appropriate software or system to use. And then they will we'll work together on developing those systems. And then in terms of OT, a lot of our experiences have been around motor development, fine motor, gross motor, and getting their insight in those areas and determining what, again, will be the best steps for the child to develop in those areas. I mean, those are just some examples. I'm sure, like I said, SLPs and OTs could probably give you a much more comprehensive answer.
I'm working on doing a Facebook Live. In this climate, as the SLPs and the OTs that I have approached are a little reticent, but I hope that over time we'll be able to do that. That's my hope anyway. We're living in interesting times right now. So Louis,
Yes.
Louis.
How's it going?
Louis. So you don't work with kids?
No.
What do you do, Louis?
So I work with adults.
Yep.
And specifically in the context of the criminal justice system or the forensic mental health system. So for quite a long time, I worked with adults with developmental disabilities, just on inpatient units and in the community. And then I moved over to the forensic mental health program. And so that's any individual who has what the law would call mental disorder, and that's a fairly broad thing.
Yeah.
But came into contact with the law. So they could be not criminally responsible, meaning they did something that was against the law, but us as a society and the law doesn't view them as responsible for that because of the challenges that they were having. Or they could be unfit to stand trial. So a lot of people with intellectual disability may not be able to defend themselves in a court of law or appropriately instruct their lawyer, or may not understand the legal system. So they could be designated, and these are like official legal designations, not criminally responsible or unfit to stand trial. So right now, I got to kind of smush both those worlds together, and I'm very excited about it. The last 2 years I've been on a team that is forensic dual diagnosis team. So it's specifically for individuals with neurodevelopmental disorders within the forensic or criminal justice system. So my work is really trying to help adults move through and out of the forensic or criminal justice systems.
Yeah. I was told by somebody one time that when an adult an autistic adult is in crisis, there's two choices. There's the psych ward or there's the police department.
Yeah. Unfortunately, the systems that we have out there, as far as legal healthcare, are not built for individuals with intellectual disability or autism or developmental disabilities or other complexities, especially the forensic system and like the legal process is, I would say, really unfair to people with autism specifically and with developmental disability. So we see a lot of people falling through the cracks. We see people on inpatient units for years and years because the risk assessments and the way we make decisions for people with mental health issues in those situations are not built for people with intellectual disability. So they will demonstrate risk repeatedly where it may be them attempting to communicate or having challenges within a very unpredictable and sometimes dangerous environment. And so they get caught up in that. And unfortunately, the crisis system is really, you have to be at the point of complete despair to get an inpatient admission or to get the help you need. And it's it's a big problem in Ontario, and I would say all across Canada.
So what does a person have to have gone through in order to enter your office? What kind of person, can you answer this?
Sure, yeah.
What kind of person do you see by the time they've gotten to you? What has happened to that person in their life?
So typically we are, we get called sometimes the point of last resort, which is terrible, but really, if I get a referral across my desk, it's either because they've had charges laid, went through the forensic system, and are currently on a locked forensic unit, and they are stuck there, right? So that's where most of our referrals come from, or they're sitting in a jail cell and they need to get out, or a lot of times we get referrals for people that are in the community and are like really at risk, right? So they've had repeated interactions with the police, they might have charges pending, or they're just at risk of harm through behavior that could lead to charges. So we do have a bit of a branch for referral that is like pre-criminalization, like how can we prevent someone from entering the forensic system or the criminal justice system. But typically they've had some very traumatic experiences before they've come to us. They've had interactions with police, they've had crisis. Most of them have been through, the revolving door of emergency departments over and over again. They've been stuck on inpatient units, totally inappropriate ones, like a general forensic unit at like the nearby hospital. Those are not ideal situations for people with neurodevelopmental disorders by any stretch of the imagination. So by the time they've come to us, they've probably seen quite a bit, and their families and themselves are at a point of extreme crisis. So unfortunately, we don't see people at their best, but we try to help them get back to that.
I imagine definitely not at their best.
No.
How do you establish trust with somebody who comes through your door?
So it can be challenging, because when you're on a locked unit and the courts are saying you have to be there, it's not the same as someone approaching you for help because they want to develop a skill or they want to deal with a mental health issue. It's like, the court is telling me I have to be here and I have to get treatment. So there is quite a bit of trust building that needs to happen. And I think in my role specifically, it comes down to talking to the person, telling them about myself and learning about them, and just engaging in kind of activities that they would find enjoyable and safe, and finding those environments. And one of the big jobs that we do is try to, there's kind of a myth I think out there that behavior analysts try to get in there and change the person, but it's actually the opposite, where our job as behavior analysts is really to go in and transform the context around the person. So we're never trying to mold a person, we're trying to mold everyone around them. And so a lot of my work is training psychiatric nurses or people on inpatient units or even people in correctional settings on how to manage their behavior to best support the individual. So a lot of that trust, I think, is built through building a system around them that facilitates trust. And so that's a lot of the work.
How much time do you get to spend with your clients?
Actually, in the service that we have, I've managed to keep the kind of intensive caseload fairly low. So I have probably like 30 open clients, which seems like a lot for one person. But out of those 30, I probably have 8 that I'm like actively engaged with, either doing an assessment, skill building procedures, staff training, safety plans, that kind of thing. And I get to see them every week, which is great. And when I was working on inpatient units, I see them every day. So, in the morning, you go around, say hi to everybody, and you get to see them frequently enough that I think can be effective. I think in a lot of the consultative roles in Ontario, because of funding and physical capacity and that, that can be a challenge, right? So you might see your client like once a month, and it's, I always wonder what impact we can have with that kind of ratio. So a lot of, and there are guidelines, and John Bailey is one of our big behavior analyst ethics guys, and he recommends a caseload for consultation of around 8 to 10. At that point,
But you're seeing 30.
Well, there's 30 on the caseload.
Okay.
So they're in. One of the things I should mention is it's not just kind of me, Lone Ranger, doing this.
Hey, you are Elvis.
Yes, apparently with that.
Yeah, you are Elvis.
But I work with an awesome nurse one of my favorite people ever. I work with a social worker. We have a psychologist on our team. I work with OTs. We do consult out for SLP all the time, psychiatry, and I wouldn't leave home without these clinicians, right? So we're working. You don't have a choice. You're working with people that are extremely complex and they have complex circumstances. So they have medical issues. They may have had a brain injury. They have there's family dynamics, and you realize really quickly in those kind of settings to be humble clinician, right? So I'm never one of the, I would never say, ABA is the only thing that works for these guys, because they are extremely complex. Is it an important piece to understand their context and to look at the positives and skill building? Absolutely it is. And I think behavior analysts bring a really important lens to those complex cases. But really, like if I didn't have a nurse on this side, social worker on this side, psychology here, it'd be really challenging to get any work done, because these are individuals that need full, like real kind of wraparound support. So I've just learned to benefit so much.
I want to ask you one last question, then we want to move back to sort of more OAC stuff. But do you have a sense of the history of your clients? How many had supports when they were children? Do you know about their childhood?
Yeah, absolutely.
And what kind of supports did they have when they were little?
So I would say that, maybe all of them. I'm trying to think of a single client had no supports, right? So they had very little in the way of treatment or early intervention. I don't think I've had a single person, and I'm talking about like hundreds and hundreds of clients over the years, that had early intervention. Oftentimes they were, put through repeated expulsions from schools. They were in and out of different facilities. They were crown wards at some point. A massive amount of them experienced neglect or
and
abuse.
A crown ward is
So that's
foster kids.
Yeah, basically when you're kind of you're a ward of the state, or you're the province kind of takes on the responsibility of your parenting. So that we see that a lot. And as far as trauma goes, a lot of these individuals have trauma histories. Like I would, they say you should have a universal perspective when you go in, assuming that 100% of your clients have a trauma history, because the real ratios in mental health are 90, 80, 90%. So usually people get to us because they haven't had those early supports. So I don't see a lot of people who had really kind of comprehensive programs or that had really good supports in schools. Usually it's the opposite, where those supports weren't there, and then it kind of led to a lifelong inability to gain the skills they need to be safe in the community. And we get a lot of people, we get a lot of young people. So people who fall off the cliff of child services, right? Because you turn 18 and it's like wham, or 21, you're out of school. There's no day programming. You're on every list for housing and that. And you're like, in mom and dad's basement, just with like the whole 24 hours a day on your hands. And so we get a lot of young folks.
So this is huge. We could talk for hours.
Absolutely.
How about this? And thank you, Louis. I want to switch gears.
Sure.
So I want to ask you about regulation.
Yes.
Now, I'm fairly new, relatively speaking, to the OAC, but I know for about 15 years now, the OAC has been asking for regulation for your profession, right? And I understand, or I know you are the past president of ONTABA.
That's right.
Can you tell me who are ONTABA?
Sure. So ONTABA is the professional organization representing behavior analysts in Ontario. So it's an organization that's grown considerably. There's, I think, about 1,300 members now. And as Nancy said, by behavior analysts, we don't mean just autism therapists. It's people who are researchers, people that work in mental health, people that work in developmental disabilities. There's lots of people working in brain injury. Some of those are SLPs, some of those are OTs, and so it's a pretty diverse population of membership, right? So some people are working in business, and I know a couple of behavior analysts that are operating businesses like a gym using kind of those principles and stuff like that. So it's pretty broad. I would say the majority of the members do work with developmental disabilities and autism. The organization's been around for about 23 years, and really the goal is to promote and advance the science of behavior analysis, and it has a number of goals as far as trying to educate people about what behavior analysis is really, because there's a ton of misconceptions out there. But the organization really provides a resource for behavior analysts, so professional development opportunities, and one big cornerstone. One of the kind of 5 pillars of the organization for many years has been regulation, right? Trying to protect the science. And
so regulation.
Yep.
What do we mean? What do you mean by that?
So regulation, in kind of the general term, means you're making sure that there's a standard of care, right? So you're making sure that people are practicing in whatever field or area they're in, to a standard that protects consumers. And so regulation, as kind of a loose term, can mean quite a few things. There's like really low levels of regulation. So there's things like you would have a provider list. So this is something that came out recently where you have to check a couple boxes on a website, and it says I have A, B, and C, and that would be seen as like a very basic level of regulation. And then you have regulation that's like a public college, and there's law, right? So examples would be like College of Psychology or speech language pathology and audiologists or occupational therapy. They have public regulation through a regulatory college, right? So that's another gold standard, right? Is you're regulated by a college, and there's a complaint process. They have standards, they have ethics. You need to have jurisprudence training. You need to know the laws of Ontario. That's kind of the dream, is that behavior analysts would be regulated through a college, right? And behavior analysts are the ones that want that the most. And it may seem counterintuitive because one, it's super expensive, right? So you have to pay quite a bit to be regulated, and two, it's like really long process. You have to pass exams. You have to, and like a lot of.
So you guys actually want to do more work and have this done?
we do, yeah. I think for a couple of reasons. One, it gives the field credibility, right? So people know that they can kind of trust people who are a part of a regulatory body, and also it protects consumers, right? So behavior analysts are like the first people to cringe when we hear stories of people saying, "I'm a behavior specialist," or whatever. And I bump into these folks all the time.
Right.
We cringe because we see how some people may be representing the field that aren't certified or aren't regulated and just are hanging out a shingle.
So can just anybody hang out a shingle?
Sadly, yes. Sadly, right now you can, and lots of people do. Some of my earliest experience, and even recently, meeting other behavior specialists, is that they could have like a year of an undergrad in psychology and then decide, screw school, this is taking too long. I'm a behavior specialist, and then they go out. And because there isn't a really solid way to differentiate, we can try to educate the population about, there's BCBA, there's other things that you should look for.
Right.
But lots of families don't know of those resources, and if somebody's advertising their services, a family will hire them.
You can just Google ABA and look for
you can,
somebody in your neighborhood.
There's like Yahoo groups and stuff that will be like, hey, I'll
go there. They're around the corner.
So it's a big problem.
Yeah.
And behavior analysts are the ones that want to see that it's tightened up.
So Nancy, in your experience, the lack of regulation, what kind of barriers does that create for you and your colleagues?
Well, I think the most important thing is that when behavior analysis is practiced improperly, so when it's not done correctly by the right people, the right oversight, it's harmful. And it's heartbreaking to see that happen. It's wrong as a society, Canadian society. I would think that we want to protect our most vulnerable individuals that we work with. And so, I think it's more about the clients that we serve more than anything else. Like me personally, I'm registered with the College of Psychologists, and I have a lot of rules that I need to adhere to, and I happily adhere to them.
Yeah.
And it's really, it's just really harmful. I can't believe we're still talking about this in 2019. It's outrageous to me, quite frankly.
Yeah.
I can't believe that anybody in Ontario, when I talk about this, with individuals from even the media, I've talked about this with, my hairdresser and the bank teller, and they're saying, what, you mean like anybody, even MPPs I've discussed this with, and I've said, yes, like literally anybody can practice behavior analysis. I say that in quotes because, they're not doing what, us that have gone to school and, done what we need to do can do it. There's other pieces too, even around like things like record keeping. What do you do with data? How do you bill? I mean, it gets into all of that when you're regulated appropriately. And there are no standards for that. People should be worried about that. where is your child's data? That's personal information. That needs to be accounted for.
If a parent has a beef with a provider, what can they do?
Well, it depends, doesn't it? Because we don't have regulation right now. So if they are boards, well, first and foremost, I would say, talk to your provider. Okay, let's do, what is it that's the issue? So we're speaking very generically, but I would hope that, along the way of treatment, that there is communication and there's ongoing dialogue, right? So that if there is something that's not working, let's talk about it. Let's figure it out. The most important thing in our jobs are to help children live their best lives and involve the family. We have to do things that matter to the child and to the family. So talk to your provider. But if that doesn't work and it can't get resolved in that manner, if the person is a board certified behavior analyst, there's certainly complaints processed through the BACB. Okay. Now, if it's a breach of ethics violations, it can go there, but they are limited in their jurisdiction in Ontario. So they're excellent, and I'm board certified behavior analyst too, and I'm a huge proponent. I'm a BCBA, and I'm a huge proponent of the BACB. That's our board. But they're limited in terms of what they can do. But you can certainly do that. If they're a psychologist, there's the College of Psychologists. And guess what? For anybody else, maybe you just leave. I don't know. It's a huge problem. I don't know if you have any other.
But this is something am I wrong in that this is something you've taken upon yourselves to create?
Absolutely.
So it's not that there's a governing body who's going to go, nah, Nancy, or nah, Louie. You are policing yourselves and each other because if you're responsible.
So the BACB does have some powers to they could.
So what can they do to you?
They could remove your certification. But the question becomes, if they me specifically, So if they removed someone's certification, in Ontario, I could be like, well, that sucks, but okay, who's up next for my therapy, right? So it can be powerful, and there are some policy memorandums and stuff that do mention the BACB, like the QAM in the adult sector does say, if you're putting a behavior support plan in place where the person has dangerous or challenging behaviors or behaviors of challenge, then you need a BACB involved, which is a great start. But it doesn't say it for basically anything else that goes on. So the BACB can be powerful if the person's certified. If they're not, they can't do anything to them, right? They can't say don't call yourself a behavior analyst. We can complain about it, and we can behavior analysts have a responsibility to kind of confront those folks. And when we bump into folks that are doing something unethical, we say, hey, that's not cool, and that's we spend a lot of time doing that when we run into those situations. But the other thing I would say is, think about your interactions with any business or consultant, right? So if someone is doing something illegal, then you get a lawyer involved, or the police if it's something like that, and hopefully it isn't. Better Business Bureau, things like that. Like if you have complaints specifically about how their business is being run, like a lot of people out there, I would say, who aren't necessarily certified or regulated or don't have that kind of training about how to ethically run a business, may not be following the specific practices outlined by the Ontario legal or labor laws or by the CRA, right? So these could be places you could take some of those complaints depending on what they are. But until there is like a Ontario stamp of approval on a regulatory system like a college or there's other ways to approach regulation.
Right.
Unfortunately, you're kind of at the whim of somebody putting out a shingle like it's.
So last question about regulation. What professions of folks that work with our kids are regulated and who aren't? So SLPs, are they regulated?
They're regulated.
OTs, are they regulated?
Regulated.
Nurses, are they regulated?
Regulated.
Pediatricians.
Regulated.
ABA.
Psychologists.
Psychologists are regulated.
ABA practitioners?
Regulated.
Not regulated. Okay, let's
so
go to
the one thing I want to put one point.
We need to move on because we are already at 42 minutes.
Oh, okay. So let's move on. So the two things I would say is that Ontario paid all kinds of money in 2012 to launch this whole assessment about regulating behavior analysts. It's called the SEG Consultants Report. The Ministry of Children and Youth Services, which it was called at the time, Launched that in 2012.
So that was Michael Cotto's old job.
Even before that.
Even before
yeah,
that.
it was
So a
before
whole bunch
then.
of other people.
Yeah, a couple ministers ago.
All right.
And so they launched this massive environmental scan where they talked to all, like to social work, to psychology, to education boards, to parents, all the different colleges and universities. They did that massive scan.
Were you involved with this?
We did do some response to it back then.
Okay.
But at the time, they did this big scan. They said, should we regulate these guys was the question. And the overwhelming response from SEG, which is an independent body, right? They're an independent research group. They're not, the government. They're not behavior analysts. After they did this huge report, they said, absolutely, you need to regulate these guys. They outlined like a 5-year plan on how to do it. The finances. I saw somebody ask a question about the cost of it. It's all in that report. So we have behavior analysts have, and I know Ontava has, for years been waving this SEG report around saying, remember you guys did this report, you paid for it. And,
so it's been done already, it's been paid for.
It's all done, it has it all
ready to
outlined
go.
there. Yeah.
Let's move it.
Let's move on, right?
The only barrier is political will. Like they don't want to do it. And so
okay, wait. Why? Why don't they want to do it?
I'm not sure. I think maybe it's harder to mess with a regulated service or like a medically necessary service. Like if I was going to, for example, try to remove your sedation for a colonoscopy, that would probably be harder.
That would be a hard thing to do.
Because regulated professions and protected services, people freak out. Where I think.
Don't even go there. I just turned 50. I got the letter.
Oh, no.
Oh my God, Louis.
We'll find you some sedation.
Let's go. Thank you so much. Okay, let's go to the questions that people have sent us.
Sure.
Tangerine. So I'm sorry it took us so long. We had a lot to cover, everybody, and we'll try to go through these questions quickly and then scroll through the feed. I hope you bore with us because I think this was really important information for people who are new and trying to figure out all this stuff, right?
Sure.
Tangerine. Hi, Tangerine. She says, hello. My son is 19 months old and he was diagnosed with ASD 3 weeks ago. We will be doing ABC parent coaching in home with a psychologist for a few months through a research study. I'm wondering what my next plan should be for him once that is completed. At that age, how many hours of ABA, if any, should be done at home? I'm home until September, or at a daycare or at a center. So new to this, any advice would be helpful. Okay. Welcome to your life, Tangerine.
Well, first of all, I would say, Tangerine, good on you for finding other families that you can talk to and support each other. I think it takes a community to help support all children on the spectrum, and for reaching out. I think that takes a lot to reach out and to ask questions and try to figure out what's best for your child. I would say that, again, going back to those BCBA healthcare guidelines for autism, I would not be able to say this is how many hours your child gets, right? So we go back to that, each child's, oops.
Oh.
Sorry, I'm gonna turn this off. I'm sorry. Did we get shut off? I'm sorry. Oh my gosh.
Hold on.
He's gonna keep doing that too.
Someone is messaging Nancy, and
Sorry.
I hope we didn't lose the feed.
Go back to Chrome.
That's fine.
Gotta go back to Chrome. Where is it? Right here.
Here.
Sorry, everybody. Technical difficulties.
Sorry.
Nancy's gonna tell her son
Those pesky
to
kids.
to quit it
I'm sorry. He's gonna keep doing that.
because he wants to
Do you
FaceTime
want
his
to talk
mom.
about individualization, and I will call him and tell
Decline.
him.
Sure.
I'm
I'll be back.
declining him.
It depends on the child's needs.
Oh my goodness.
Yes.
He is very persistent. She must be a great mom. I'm not going to accept you, honey. I accept you, but I'm not going to accept you. Okay,
So,
go ahead. Lou.
I'll probably save this one for Nancy. I think she'll have a great answer.
Okay,
But what I would
let's move
what I
on.
would just say is really the whole crux of any child's care should be individualization, right? That what their needs are need to be determined based on them. We have a caregivers report, or Ontava has a caregivers brief report about treatment for ASD.
Yeah, it's on their website.
It's on our website under reports. You can check it out.
Yep.
But what it really outlines is that your assessment and whether you should go to in the home or at a center, or how many hours and all that needs to be figured out through a very comprehensive assessment of your kids specifically. It's one of the reasons I love ABA is that it treats each person as an individual, right? So it's about you in your context and not about, big group studies or what works for people in general. It's like you and your specific.
An individualized plan.
Very individual.
Right?
Yeah.
Maria, you can answer this. Why can't ABA therapists share a college if that would make it easier to be regulated? So could you join the College of Psychologists? Could you just piggyback onto them?
So there are a number of combined colleges, like the SLP and audiologists kind of got together and did their thing. I know that there are colleges where a number of disciplines practice, like psychotherapy. If you're a social worker, a nurse, an OT, or psychotherapist, you can be regulated under that college. I wouldn't say it's an impossible thing to do. Personally, as a behavior analyst, I think the goal is to have a college that is specifically built for behavior analysts. But is that an impossibility? I don't think so. Would it require some real thorough planning and negotiation in that? Absolutely. But I feel like at this point, behavior analysts are considering all possible options. My one thing is, when you join if you join with a college and they're humongous and you're tiny, how do you protect the integrity of your field, right? So you wouldn't necessarily have a lot of decision-making power on a board like that. But if there are ways to come to agreements around some autonomy or decision-making, or what's in the best interest of behavior analysts, then again, I wouldn't dismiss any possibility, but I would always, I think, strive for an independent, autonomous college. Well, of course, and not just to be like, taking my ball and going home, but that the standards are built that are specific for behavior analysts. The training, the jurisprudence is for behavior analysts. That would be, in my opinion, the outcome that would lead to the best standard of care. But like I said, I don't think anyone really is saying like no to anything. And actually, what we've heard is that the government is looking at a model of condensing all the colleges down into smaller groups, right? This idea of, it's called right touch regulation. Is a similar model in the UK, where they took like 30 colleges and they turned them into 7, right? So you would have like psychology, OT,
you mean sort of
SLP,
like merging women's affairs and
super college,
children and youth
just put
services,
super behind it, and the government will
that's
love
all going to be
super health,
much easier to manage that way, right?
Well, it may be a bureaucratic nightmare, but
so why do some providers, Maria also asks, why do you use different diagnostic methods for your students and clients? Some people use ABLS, some people use the VMAP, VB-MAP. Is there a reason for that?
Good question. So first, just again, to go back to that, we talked about that conversation, and I know it can be confusing for families, the difference between diagnosis and skill-based assessments. So most ABA centers will not be doing diagnostic assessments. And I say most because there might be some that have a psychologist or an appropriately trained medical doctor who does diagnostics. But that's different. That gets you that, in our case, the diagnosis of ASD. And that's where
is that
stops.
the VB-MAP?
No.
Okay.
That's different.
All right.
So what I think this question is asking is around skills.
Okay.
So those are those assessments that we use at intake and throughout to determine the child's skills. So, and there isn't a one size fits all for that either. So here we go back to that, so the behavior analyst should really determine the skill-based assessment that they're going to use based on those presenting goals. So the ABLS and the VB-MAP, those often cover a number of different skills, some of those core goals. So a lot of times around communication, imitation skills, some of those early readiness skills, self-care skills, those core skills. There's a ton of other ones. I actually brought like a ton of examples. Here's another one. This is the assessment of functional living skills. So this is going to focus more on independence and self-care. So if I have a family that's asking about that, this one might make sense for that child. There's the VB-MAP. We talked about that one. There's another one that a lot of people aren't familiar with. This is called the Essential for Living. I love this one, again, for those self-care skills as well. So it depends. Social skills, I got a ton for social skills too. if we're just looking at a focus program for that. So ideally, as long as there's something to back up its use and validity, there's a lot out there what we can look at in terms of skill assessments, and it should be based on, well, why are you here? What are your goals? And let's make a determination based on that.
Amanda asks, is it possible to set up a behavior plan that allows the child to stim even if they are disruptive? If so, what would this look like?
So again, it completely depends. I have lots of kids here who engage in self-stimulatory behavior, and great for that. Like, do go ahead and do whatever works for you.
Is stimming a big deal for you guys?
It's real.
And so I think there's the conception that behavior analysts think stimming is bad, and this kind of brings us back to this idea of regulation, that there are likely practitioners out there, and historically, I imagine in like the 70s and 80s that these things are done, but there are people out there that would stop stimming just because it's stimming or it looks weird. But as far as our code of ethics and standards goes, the targets that you are looking at for skill building or for to replace need to be meaningful for that individual, right? So if one of my clients is stimming, even as an adult, I'm not immediately like, we got to stop that stimming because it's weird, or I don't like it, or it's different, or it's attracting attention. Go for it. If it could be calming, it could be something that is organizing for them. That's helpful. Behavior analysts will sometimes target stimming if with the person's consent, with the family's consent. Like, there's no just like I'm jumping in and stopping it. But we'll target those things if they're harmful. So I've worked with many people over the years that their stims can cause physical damage to their bodies, right? So it's like face rubbing until it's raw, and extreme callousing, or chewing on the hand until there's exposed muscles and stuff like that. Or if the stimming is a complete barrier to your learning. So in some examples, individuals will stim 24 hours around the clock and cannot actually kind of engage with another person. And that becomes, if you're unable to eat a meal because of that, usually what behavior analysts would do would be to teach you to stim, at a specific area, or to request to go stim if you need to. But it isn't just like a mandatory thing that we're like, stop stimming as a goal. And like I said, usually the priority is based on that individual's goals and their family's goals. And that.
My child is yet to receive service, but 40 hours a week seems like a full-time job. Well,
sure.
Yeah, it is. How do you ensure that the child is not overworked? I remember I don't know anybody that has 40 hours a week. I think at one time that was the case, and I remember too, when my kid was starting out, I'd just be looking at the description of ABA and what you're going to do. And I just went into the office and spoke to Molly. I'm like, is this any fun? Is it any fun here?
It is fun.
It is
Are we going to go outside and play?
Of
Is
course.
there a recess?
Yes.
So 40 hours a week, who knows who's getting 40 hours a week? Maybe nobody anymore. But that seems like a lot for a little kid.
So first of all, I want to really make sure that everybody knows that not every child needs 40 hours a week. Okay, so go back to like, what are the goals, where are the skill strengths, where are the needs, and there needs to be determination based on that. The second thing is that ABA, sometimes when people Google, like, well, what does that look like? And they see a kid sitting at the table and they're doing all this stuff, and it's like repeated trials. That for some kids, they may need that, and that works for, and some kids actually choose that, by the way. I've read studies. I'm in the middle of conducting a study that asks kids, how do you want to learn? Some kids actually they prefer to sit at a table in a really structured manner, and other kids prefer to learn that exact same skill in a scavenger hunt fun game. Let's learn prepositions like that, right? So, but regardless, it is not that for 40 hours a week. Okay, so there are learning trials, there are breaks, there's tons of reinforcement. I mean, kids come running into our center when they get dropped off because they're like, this is where all the good stuff happens. I got the good stuff here. Also, remember, ABA is a science of learning. So learning can happen anywhere. We go outside and we play. What time is it, Mr. Wolf? to learn your numbers. You know, that's how we play hide and seek to work on social skills. And so that's all within, if it's appropriate for that child, that would all be within that. Part of learning is over snack time and lunchtime. And so most of the kids, when they come here, this is just, they call it school. Okay. It's a treatment center, but that's what or it's just like, I come here to play with my friends. Like they don't know, it's just, good behavior analysts are embedding teaching and learning. Like right now, I just went to answer my son's phone call and I was like, honey, mommy's in a Facebook Live. So here's a learning opportunity. You're going to have to wait. I will talk to you later. Right. Like that's what we do. So it is not, I know, I caution you when you look at those kind of examples of what ABA is, it should be individualized, and it's not that all the time.
Shannon asks, definitely interested in ABA in the school systems. What could this look like? Big question.
Wow. How much time do we have left? Yeah. I will say, and then I'll shoot it to you, Louie. But I think so. In places where this works really well, so I'll give you an example of a state, Massachusetts. So in Massachusetts, you have ABA funding across multiple departments. That's their ministries. Okay. You have it under healthcare that provides like what we do here. It's treatment. And so we work on those core symptoms, right? We want to get those really strong so that a child is in a position where they can really learn from their natural environment. That's the ideal. Now, granted, there are going to be kids who still need help when they get into school. A lot of kids need help accessing the curriculum. And so that's where, like, for example, Massachusetts, where ABA can also fall under the Department of Education. And what it looks like in school, essentially, again, because ABA is just good teaching and how we learn, it's looking at the curriculum and having ideally behavior analysts in that tiered service delivery model that we talked about. The wedding cake, right? In Massachusetts, I have friends who work in the public education system there as behavior analysts, and I was talking to them a couple weeks ago, and they're living the dream because in a lot of their districts, for every child who has been diagnosed with ASD, there is a BCBA who's assigned to them, who works with the teacher. Okay, so what does that look like? I know I'm going, oh my gosh, you guys. But what that looks like is they're looking at the curriculum, and our job as behavior analysts in the school system is to figure out how can we help this child access the curriculum. So we're really good at that. Like Louie was saying, we can make changes to the environment. We can look at accommodations. We can look at modifications so that the child is learning in school. So in an ideal world, you have support under multiple services that basically support behavior analysts who help kids learn. That's our job.
Liliana asks, I would like to talk about supervision from BCBA with programs and staff. The rules, 10% of an hour per week on a client's hours. Okay, so how much? I think we covered some of this. I'm sorry, Leanne, we sort of talked about this, like the breakdown of it, and I want to move on, but thank you for your question. Julia asks, what can parents do to parent their kids congruently with what's happening in IBI/ABA with their kids if therapy happens at school or at daycare? So when I was home on mat leave and June was doing IBI in our home, I picked up a lot. Now I'm back to work. I feel lost.
I would say very briefly that, like, actually the room that we're in right now, we use for our parent coaching. And so, work with your providers. It is, again, part of those healthcare guidelines that we work with our families and, work on, I never expect parents that I work with to be therapists. But we can show, that's crazy, right? But we can show you strategies and work with you to figure out how we can make it work in everyday life, right? So work with your provider, I would say, and talk about your interests. And it doesn't matter if a child's doing ABA at home, at the school, in a center. We can work with you and figure out how to transfer all those great learning strategies.
Anna asks, I've had some heated discussions about the ABA controversy and it being abusive to ASD kids, etc. and people were talking about modern day ABA. I was shown a video of a therapy session that looks normal to me and explanations of why they think it's abusive. So I would like some professional input on that. Thank you. Well, it's kind of a hard thing. There's a lot of talk on our Facebook page.
Sure,
you know?
yeah.
And I'm happy to say that not many therapists weigh in, because we're talking in the abstract here. It's very easy to accuse people of all kinds of things, you know. So what do you think about the controversy that some people say it's harmful?
Well, I think there's historical context, you know, of the treatment of people with neurodevelopmental disabilities in general. You know, if we go back even not very far, you know, the last institution was closed in 2008 in Ontario, and it's like, you know, wait, Haroni was closed in 2008.
Geraldo Rivera stuff we were talking about.
Yeah. So big institutions, and then if you go further back, you know, all across the disciplines, social work, psychiatry, psychology, and behavior analysis. Doctors, you know, there's been historically a lot of really negative practices, and or practices that weren't particularly respectful of each individual's dignity, right? So, and again, across the board. So as a society, I feel like we've come a long way since then, and all of the disciplines are kind of reflecting on those periods, including behavior analysis, and looking at, you know, how can we be better about this? I would say that looking at present day, if things are occurring, my first point is to just kind of go back to this idea of regulation and standards of care. Because if people are doing things that are actually abusive, it's certainly not, you know, a foundation of ABA as a science. Like ABA is comparable to physics, right? Where it's like that's the science, and then someone applying physics in a specific way is another thing, right? So the atomic bomb was made by physicists, but you throw out of physics. So what you do is you regulate and protect. And so I would go back to that. But, you know, I do think behavior analysts need to own the pieces of our history that are unsavory. And, you know, I do. There's things that I totally cringe at when I see, and there's things that I cringe at the other disciplines. I'm sure doctors and nurses and others do. But I do think it's important that, you know, we address individual providers' inappropriate conduct if that's occurring. The other thing I would point to is just you know, this idea of behavior analysis or ABA as a therapy, right? That it's like ABA is a thing that you do to people, and just kind of going back to the concept of ABA is kind of the science of how everyone learns, rather than like a technique to do onto someone. But one of the things that I found really helpful recently, because I've been in a couple heated discussions myself around
I hadn't noticed that.
but you know, actually connecting with you know, whether it's actually autistic self-advocates and going through their experiences and concerns is something that I'm trying to get better at. And I think that I've had a couple really good enlightening experiences about what someone specifically encountered and what their life experiences have been, and then, you know, how they kind of got to this perspective what ABA is. And then I'm able to say, well, you know, my whole job for the last 15 years has been to reduce chemical sedation, to reduce use of seclusion, to reduce mechanical restraint. Like, that's my job. So if someone says, you know, you're abusing children, you know, I'm pretty defensive immediately about that, because I'm like, I've spent over a decade getting people out of locked seclusion and get back into the community. Like we recently discharged a young fella who spent, you know, close to a decade on a locked forensic unit. And we had a little party for him because he's now living in community, his own apartment, moved there this week. And, you know, so I think there's a lot of misconceptions about ABA, and a lot of that is historical, and a lot of that is bad clinicians. And, you know, I think like any other discipline, you need to regulate, you need to hold people accountable. But I wouldn't throw out an entire science of how people learn for that reason. And could we be better at communicating who we are? Absolutely. Behavior analysts are terrible marketers, right? We go and we're like, well, the data says that the stimulus control says this, and people, you know, it sounds cold and it sounds this, but as Nancy said, we're trying to help people live their best lives.
It does sound cold. That was my.
We're a bunch of nerds, and we graph, and we.
You guys are nerds. You totally nerds.
So can I just add to that? Like, as ABA as it applies, Louise' points are well taken. ABA, as it applies to kids with autism, I keep saying this. My number one goal is for a child to live their best life, to be the person whoever they want to be. That's what that's why I love this field, and I'm not the only one. There are times as professionals that it's not the easiest job. We take our jobs home with us. We truly are dedicated and passionate about what we do. But I think as a profession at large, again, there are individuals certainly in any profession that needs to be addressed, but that we are a very compassionate field, that our history is that we demonstrated and showed that any individual person has the right to live their best life and they can learn. And so, if we even look historically at what's the alternative to ABA, we know that because there's some studies where there's control groups. And look what happened to those kids who didn't get ABA. We know.
Well, you know all about that.
So well, Louis does too, even just from life experiences. So I just want to give you some examples of what we do. So we do things like toilet train kids. And I'll give you an example of when the last round of funding, when there was that 8K, 10K funding. And so we were very fortunate to get a bunch of kids who were 8, 9, 10 years old that we could help. And all of them came here in diapers. So guess what? The first thing we did was to give them independence and dignity and live their best life and the parents wanted it. And a lot of the kids did too. We're going to help teach you how to use the bathroom by yourself, and to the point that now they're going into the bathroom and nobody's in there with them. Mm-hmm. And that is amazing to me.
So important.
We teach kids how to tell us what they want and need, and I know I've seen what that looks like when you don't get taught that. We teach kids how to make friends. We teach kids conflict resolution, to say, I don't like that, to advocate, and so those are just a few examples, but I will say, definitely the regulation piece is important. We need to ensure that we're doing this appropriately. But the goal that we have is to help kids so that they can be doing it all on their own, rocking it out in this world, living their best lives.
Sean asks, I'm going to cry. Sean asks, how can we encourage young people to enter behavioral science? And what kind of strategy would you implement to encourage growth in this sector? So you want to be a BCBA?
Sure. Well, I would start by saying that the growth was like off the charts for the last 10 years, that people were entering the field faster than ever before. Like we have this graph of like the growth of board certified behavior analysts or board certified assisted behavior analysts or RBTs in Ontario. And the graph, to go back to the nerd thing here, the graph is like in the last 5 or 6 years, there's 9 college programs in Ontario that train instructor therapists and kind of the technician level behavior analysts. There's 2 strong master programs in Ontario. Because the need is there, there's the support of the evidence, and that the government was, and we all know that almost every government that's been in Ontario for the last 30 years, so it's tried to mess with autism specifically. But there was the kind of support there for it that led to kind of natural growth. So we've always talked about this capacity issue, but the reality is that I think a lot of the college programs over the last many years have been turning people away because there's a lot of interest. People want to work with kids. They want to learn the science.
They're turning people away, but we don't have enough therapists in the province.
Yeah, but I think it is growing, or has been growing up until now. I really worry about what this government has done and the impact that'll have on capacity. Mm-hmm. But more people are entering the field than ever before. So although the capacity isn't quite there, because the rate of growth of the prevalence of autism diagnosis is moving at like lightning speed, right? So we're like at 1 in 66, and I think even that's the average between boys and girls. I think boys are even at a lower ratio of 1 in 58 or something like that. I'm not sure the exact numbers, but so that the actual frequency of people diagnosed with autism is going up faster than we can keep up. So, but it has been actually going pretty well. What I always suggest is, like Ontaba has a role for that. So we go to the different colleges, there's job fairs and stuff like that, where we say, here's what behavior analysis is, because most people, they never even heard of it.
No,
right?
I never did.
Yeah, exactly.
Never did.
There's no cool TV shows about people teaching people skills and stuff. I'd love to see that TV show.
Yeah,
but, Criminal Minds are a behavior analysis unit, but it's not really the same.
Whoa.
It's not really the same thing.
Whoa.
I like to pretend that that's what I do.
Yeah. Coming in with your flip chart pen and your checkboard. Oh, that'd be riveting TV.
It would be.
Yeah.
I'd watch it.
Okay, Melanie asks, I would like to hear something about youth 12 to 18 and their needs and the transitions
Yes.
to adults starting at 16. What kinds of supports are needed from an ABA perspective? So,
I think you could probably bust out, this.
Yeah, there you go. There's
Nancy,
one.
whoever,
Yeah.
it's Partington's going to owe us a royalty after this
Yeah.
one. Anyway, one of the things that I often see, like that you brought up, is that a lot of people kind of enter adulthood without kind of the basic functional skills to navigate their environment safely, right? Like, so even just being able to find your way to someone who can help you, or toileting independently is so important, because we know that individuals with neurodevelopmental disabilities are more susceptible to abuse and exploitation. So if you can take care of yourself and be assertive in that, those are so important. Self-care skills, academics, vocational skills. Like, I would really love to see behavior analysts in the adult sector transitioning much earlier in schools, so that they're preparing people for, if it's group home living where you might live, or if you can live in your own supported independent living, or if you can, whatever you're going to do, we start working on the skills you need to do that. TTC training, stuff like that, or public transit training. But as I kind of mentioned before, there's kind of these supports that are in the school system or through the children's system, and then you turn 18 or you turn 21, and it's like, whammo, you're gone, right? And I know there's a great Noah and Gregory's law that was they were putting forward to try to prevent that gap, right, of the child to adult system. But really working on those functional life skills. What do you need to be a successful adult, whether it's social or communication or safety in that, and work on those early, and work on the transition earlier, right? But I find so often it's just you're kind of in school doing the school thing, and then bang, you're an adult, and everything drops away, which is unfortunate.
We're going to wind down in about five minutes.
Okay.
Go ahead, Nancy. I'm going to try and scroll and look for questions if I can.
I was going to say some of the other things that when
Louis, yeah.
You got it.
Oh wait, here it is. Okay.
There you go.
Sorry.
You got it.
I know.
I was going to add some of the areas that I've certainly, with some of the individuals with ASD that I've worked with, that we've talked about is, if they're looking at vocational skills in high school, even ideally exposure to different opportunities for them. And I've had lots of great discussions with teens on the spectrum who are at that point in their development where it's like, well, I don't really know what kind of job I want to do. And we talk about, well, how about, what do you think about trying this, or this? And giving them some opportunities with the support. We've certainly done it with behavior analysts by their side so that they're successful, and try out some different things. So that's another area. And also areas around, puberty, hitting puberty, things around just like, for individuals who are interested in dating, all kinds of different pieces around that. So, again, it's the science of learning. And so if you're connected to the right people within our field who have specialized expertise in those areas, they can help individuals, learn new skills whether it's school or vocational or even just socially navigate the world. And there's certainly not enough of them, and there's not enough support in that area either.
Okay, I'm trying to find questions. I'm scrolling through, and I'm just not good with laptops. Oh, help. Sorry, everybody.
It's not.
Louis, do you recall a question?
There was something at the very beginning.
I know Sherry Caldwell asked a really good question,
Yes.
and I'm trying to find it, Sherry. And I can't find it.
Sorry, I see my face.
So we'll just. I think let's just look at. We'll answer Sherry's question if we can find it. Did you find it?
No, I don't see it. This is as high up as
Well, I can. Sherry's asked about ABA for children. You talked about it a little bit.
Yeah.
For children who are not autistic.
Yeah, absolutely. I think so. A lot of my work is with folks with genetic disorders or Down syndrome, etc. Or with people with mental health challenges in the forensic system. And because it's the science of learning, it can be effective in assessing anyone's context, regardless what your diagnosis is. Like, behavior analysts don't work on diagnoses, right? We're not part of the medical pathology model. We're not like, there's something wrong in you. that's broken or we need to fix or whatever. We're saying the context around you is not bringing out the best in you. So we're going to work on all that so that you can have great quality of life. But there's a lot of great research showing that it works or it can help people with genetic disorders, with brain injury, with developmental disabilities, and there are some resources for kids with developmental disabilities. Usually they're consultative in nature, which is, it's as good as it can get given the funding that the government allots. But if you go to some of the providers, you're going to wait, right? So the wait list can be quite long. But you might get a consult, some parent training. There's different groups for people with developmental disabilities, but it's nowhere near where it should be. And I would be the first to say, absolutely, the government should step in and start providing funding for kids with all the exceptionalities, right? So the fact that there seems to be this diagnosis, age, and gender-based discrimination in all government policies is just like the silliest thing ever. And we got to work to knock those down, right? If you're in the autism community, we're all fighting for people with all disabilities. But for the population I'm working with, it's like, yes, it can help, it can work, and not just ABA, OT, SLP, nursing, psychiatric care, medical care that understands people with disabilities, right? So a lot of doctors they get like a day of training on disabilities, and so they don't know what's going on. Yeah. But there's a lot of professionals out there who are great in this area medically, but it's they're restricted by the funding that goes in. If we want to talk like real talk, it's like the government, the political will is not to fund or focus on these areas or to make cuts in those areres. We're not going to get very far. So we need to kick butt until they do.
Yeah. Last question. Okay. I want you to dream a little bit. Okay. Yes. Just put on your fantasy cap. And for both of you, Nancy, you who work with children, Louis, you who work with adults, can you describe the perfect setting for your work? And what would that look like?
Well, I've definitely thought about this a lot.
I'm sure you have.
So,
dream away.
So I've been doing this, for over 20 years, and here's the bottom line to me: every child, right, including kids with autism, but even beyond, any child deserves the right to effective treatment, right? And that would be my dream. We live in Canada. We believe in a just society, right? We believe in bringing everybody up, lifting everybody up. And so my dream would be that we don't have to keep doing this every few years. It's mind-boggling to me. Does every child need intensive ABA? Absolutely not. Does even every child on the spectrum need ABA? No. I'm talking about those that do, getting access to it, and those that don't, if they need, supports from other professionals and it's evidence-based, then they have the right to access that too. And that's not just for kids with ABA, autism. Let's start there because there's a lot to bite off, in terms of other disabilities too. But my dream would be that children have the access to things that make their lives better and families' lives better that they deserve. And I think we can get there. I know we can get there. I believe that we are, because Canadians believe in it. Canadians do. We actually have Ipsos Reid polls that show that Canadians, 91% of Ontarians believe that taxpayers' dollars should go towards intensive ABA, IBI, comprehensive ABA, whatever you want to call it, for those that need it. So we know the average person in Ontario, let alone across Canada, believes that too. So that's my dream. And I know it can happen. We're just going to I'm going to keep pushing towards that.
Let's do it. Yeah.
Yeah.
So for me, I would, my dream would be that my job is completely unnecessary, right? I wouldn't have a job. That would be a start. Every person that comes across my desk as a referral is an abject failure of our social and health system, right? The fact that we are still in 2019 criminalizing neurodevelopmental disabilities and mental health, that the fact that I'm going to visit a 20-year-old guy with autism in jail shows that we've failed as a society. So, my dream is that those individuals would have access to effective treatments across all disciplines, whether it's health or mental health or behavior analytic, at the intensity they need right when they need it, right? So I know it's kind of a big dream, but it's like if someone identifies that you need this, a clinician is kind of recommending like a medically necessary treatment for you, you can get it, and your government supports that, and society supports that, and you don't have to every 4 years take a sign and go scream at someone's office to protect it. But that would be my goal, is that, you know, when people need those supports, they're provided in a therapeutic environment that isn't a jail cell or like a locked unit, because they don't belong there. And it just shows that we're not doing enough. You know, the one plug I would put is the Ontario Ombudsman, Paul Dubé's report, Nowhere to Turn. If you haven't seen that, it's a 2016 or 2017 report called Nowhere to Turn. And it just outlines how we kind of got to the point of putting people with intellectual disability in jail or in forensic systems, right? So that's my dream, is, you know, people get what they need so they never see me, you know, and it becomes unnecessary to have those kind of supports, crisis supports. Like, we're waiting till the last minute where everything's terrible, and then we're, you know, trying to fix it. It should be the opposite. It should be, you know, you get to see Nancy earlier on, and then you never come see me, right? And so that would be my dream as far as autism or any other disability or exceptionality, or even just, you know, neurotypical kids too, right? That they have the kind of supports that's like evidence-based. Like, the education system right now, you know, is struggling, even just with typical kids, and growing classrooms, etc. I think we need to take an evidence-based approach to education, to healthcare, to social services, and be really rigorous and protect those services.
All right.
Yeah.
Sounds good. Hey, thanks, guys.
No problem.
Thank
Thank
you.
you. Thank you for all of your volunteering.
Keep fighting out there.
Stay in the fight.
We're with you.
Thank you, everybody.
I say keep dreaming. Keep
dreaming.
hope and keep optimism.
Yeah.
We can do it. We know that it is possible for every single one of your children, you know, whether they're kids or adults, to get what they deserve. Keep dreaming.
Yeah. Stay in the fight. Bye.
See you later.
Until next time.
You may see how my face. I could have guessed. Oh my God.